Hello, this is Mike Neepsey with the One Health Coordination Office. I'm going to provide you a brief overview of the One Health and zoonotic disease goals and objectives regarding the Umbrella Cooperative Agreements. I'll also cover the roles and responsibilities of the One Health Coordination Office within USDA APHIS Veterinary Services. The One Health Coordination Office is here to assist program managers and recipients as needed to develop the most effective state-specific work plans that accomplish the goals and objectives in support of our mutual One Health and zoonotic disease mission. Think about One Health issues and zoonotic disease issues like any other program disease or foreign animal disease. Note that the goals and objectives in the reporting section of the One Health and zoonotic disease guidance are operationally focused and measurable. The three One Health and zoonotic disease goals revolve around surveillance, preparedness and response, and education and outreach. Surveillance goals identify opportunities for coordinating and developing activities across the animal, human, and environmental sectors. These activities should facilitate timely prevention, detection, and response to events involving animals. Progress reports should be submitted at least quarterly with the frequency specified in a work plan. The preparedness and response goals prevent, detect, and respond to One Health and zoonotic disease issues as quickly as possible using a multi-sector One Health approach. Strategies must protect agriculture, animals, and public health. Identify and implement best practices for partnering and communicating with cross-sector officials and other One Health partners during zoonotic disease outbreaks and One Health events. The education and outreach goals identify areas where increased One Health and zoonotic disease issue awareness is needed. This goal also includes attending, providing, or developing outreach activities, materials, and training, as well as tools to fill the gaps that have been identified. Delving into the goals, I wanted to discuss the One Health and zoonotic disease objectives. Beginning with surveillance, these objectives are to develop and maintain cross-sector communication protocols. At a minimum, you want to produce quarterly evaluation reports that document collaboration between One Health partners regarding human cases of zoonotic disease. Reports should detail confirmed or suspected cases of zoonotic disease in animals, including livestock and wildlife. Cross-sector surveillance and risk assessment plans for One Health events and zoonotic disease should be conducted. These activities include state-level cross-sector monitoring of human illness that coordinate with state and local human health during known or potential zoonotic disease outbreaks. Another objective is to enhance cross-sector information sharing, identifying and implementing methods that facilitate communication and reporting between One Health partners. Examples of One Health partners include federal, state, territorial, tribal, and local animal, public, and environmental officials. May also include industry stakeholders and academia. Estimates for the number of activities, assessments, or reports are to be listed in the proposed activities section of the work plan. Next, I'll discuss the preparedness and response objectives. The zoonotic Umbrella Cooperative Agreements partially fund the development, maintenance, and exercise of cross-sector state-level plans that prepare for and respond to national priorities as well as state-specific One Health events in animals. We want to see the full engagement of public and environmental health sectors. We'd like you to develop and conduct targeted epidemiologic studies and/or assessments of One Health issues or zoonotic diseases. This will be in collaboration with One Health partners. These activities need to identify risk factors and opportunities to protect animal and public health. Response objectives must implement stronger biosecurity practices to minimize the risk of transmission of zoonotic diseases from animals to humans. We also want to see the creation of joint or coordinated response teams to address emerging zoonotic disease that have the potential implications for both animal and human health. Support for existing or established teams may also be considered. As a final point here, propose ways to investigate, control, and eliminate, if possible, zoonotic disease outbreaks and One Health issues in collaboration with One Health partners. Details on the activities, estimated personnel hours, studies, diseases, practices, team composition, investigations, or actions may be listed in the proposed activities section of the work plan. Lastly, we'll talk about the education and outreach objectives. Funding will primarily go to research that can produce tangible, reportable results on One Health issues and zoonotic diseases, whether they're emerging or existing issues that are in animals. Projects will be given priority if they develop and execute public awareness campaigns focused on educating producers and consumers about the importance of One Health approaches and the role they play in preventing and responding to emerging zoonotic diseases. We're looking for you to collaborate regularly with local partners, regional partners, animal, human, and environmental health agencies, offering specialized workshops and exchange programs to broaden expertise and perspectives in dealing with emerging zoonotic disease. Part of this collaboration ought to include regular cross-sector zoonotic disease or One Health trainings, meetings, or workshops. These activities should seek to enhance understanding of zoonotic disease prevention, investigation, and response. These activities should produce or improve practical tools that facilitate engagement and communication, resulting in collaborative problem-solving approach among professionals from different sectors and/or disciplines. Training programs should be comprehensive for field personnel and focus on the principles of One Health and the latest techniques in disease surveillance, outbreak investigation, and response. To conclude, I'd like to speak about the One Health and zoonotic disease budget criteria. Allocation of the zoonotic disease funding should be a negotiation in relation to the work plan activities that fulfill One Health and zoonotic disease goals and objectives. This means right-sizing the allocated budget amount to reflect the quality and measurability of the work plan activities in accomplishing One Health and zoonotic disease missions. The One Health Coordination Office and I are happy to discuss activities that you may be planning. We're also very interested in your feedback on how this guidance and reporting tool can be strengthened in the future to meet our mutual goals. We can be reached at the following email address: vs.sp.ohc@usda.gov. Thank you for your time.